This is Listen Lakeland, the show that keeps you up to date on all the things that make our city a great place to live, work, and play. Today's host is a former hospital executive and currently a healthcare consultant in operations, strategy, and facility planning. She's also served on a number of city and nonprofit agency boards in the Lakeland and Tampa Bay area, including Central Florida Healthcare and the Lakeland Senior Hub, and is the immediate past chair of Lakeland Vision. Here's your host, Carol Philipson.
Welcome to the good life.
Thank you, Andrew. And today we have with us Ann Claussen, who is head of Central Florida Healthcare, and Dr. Cara Nelson-James, family practitioner from Central Florida Healthcare. Welcome to both of you. Ann joined Central Florida Healthcare in January of 2014 with over 22 years of experience in health and finance management. Prior to joining Central Florida Healthcare, she spent 27 years with State Farm Insurance Company in life, health management, and also transitioned to credit union manager for 9 years. Before accepting the position with Central Florida Healthcare, she served for 4 years on the board of directors of Central Florida Healthcare. Ann received her Bachelor of Science degree in health education from the University of South Florida. She is married to Jim Claussen, and they have 2 sons, Justin and Ryan. She is actively involved in the local community and serves on the United Way Health Steering Committee, the Empath Hospice Board of Directors, Type 1 Diabetes Research Foundation Board, and various other boards and committees. As a breast cancer survivor, she is passionate to provide support for mammograms for women who cannot afford this service. CFHC has an annual breast cancer awareness golf tournament each year and has raised over $600,000 to provide mammograms for the underinsured and uninsured women. Her goal is to facilitate a healthier community by offering easy access to health care throughout the Central Florida Healthcare Service Area, which is bigger than just Lakeland. This is accomplished in large part by numerous partnerships with local, state, and national organizations, enabling CFHC to provide expanded high-quality health care for all patients, regardless of their ability to pay. Welcome, Ann. And would you like to introduce Dr. Nelson-James, please?
Yes, thank you so much, Carol. So we have with us Dr. Cara Nelson-James. She is a board-certified family physician, and we are so fortunate to have her as our Chief Medical Officer at Central Florida Healthcare, where she's been with us for 19 years, with her goal to advance access to quality health care across Polk Highlands and Hardee counties. Dr. Nelson-James is a passionate leader and entrepreneur and is committed to empowering youth, serving the elderly, and championing wellness in her community. Drawing inspiration from her late mother's remarkable resilience and compassion, Dr. Nelson-James blends medical expertise, faith, and service to inspire others, both in spirit and purpose. Dr. Nelson-James is married to Denzel and is the proud mother of 4 adult children, and she leads with integrity, vision, and a deep belief in the power of perseverance.
Thank you, Ann. One of the goals of Lakeland Vision is to provide quality health services to all people in Lakeland and to provide preventive services so that we have a healthy community. Please give us a quick description of CFHC and the services you currently offer to the community in Lakeland. And you might just give us a little background about how Central Florida Healthcare started back in 1972 in Frostproof and how it grew over the years to where it is today.
Thank you, Carol. Yes, so Central Florida Healthcare has been in business since 1972. We started in Frostproof, Florida, and that was a result of, back at the time, it was Minute Maid, Coca-Cola, wanted to provide healthcare services for their agricultural workers. And so we started with one doctor and one nurse, and we are now in 17 locations with over 700 employees providing preventative health care to our service area. So in Lakeland, it is one of our patient-centered medical homes, meaning that it offers full services. So we provide medical and dental, adult and pediatric services. We have OB/GYN services. We provide behavioral health. We provide lab and x-ray, and we have a full-service pharmacy with pharmacists and pharmacy techs that provide education to our patients.
Thank you. In healthcare forums and discussions, we know that access and medical literacy are always mentioned as barriers to care. What are some of the most frequent barriers for access to care, and how does CFHC help address the barriers to care? And also speak to how one accesses care at the Lakeland Clinic.
So I'll go ahead and take that. So, right now, how an individual or a resident would access care mostly is because of the call center. Right now, we have a contact center centralized in Winter Haven, and there is a toll-free number that...
And what is that number?
866-234-8534.
And we'll repeat that later in the program as well.
Absolutely. And so we have approximately 40 call center representatives take approximately 3,000 to 3,500 calls a day. And
wow.
Yeah, it's an amazing feat to be able to route all of those calls. And so those call center reps have the ability to make appointments for residents as they call in. Fortunately, we also do have some medical personnel in the contact center. We have 3 call center nurses that are able to triage acuity and be able to schedule for same days depending on what an individual needs.
So, for instance, if I call and I say, I have an ear infection.
Right. So if you call and you have an ear infection, we know that's pretty acute. Right. And so we offer same day appointments and walk-in availability to be able to address that in an urgent fashion. And as Ann mentioned previously, we do have pharmacy services at most of our sites, and we're able to fill that prescription the same day. And in fact, a patient can walk out with their prescription and their first dose of treatment.
So what if I'm a mother with a child with 104 fever?
Yeah, that is also acute, right? And so we have pediatric services at several of our clinics as well. And you're able to get in for a same day visit with a pediatric patient to be able to be seen. Here in Lakeland, we have Lakeland Pediatrics, that's on Florida Avenue. And we also have Crystal Lake Elementary that serves that Crystal Lake community.
So they would be referred to one of those clinics?
Correct. So the appointment typically will be made in the call center, and if not, they'd be instructed to walk into one of those clinics if they're in the Lakeland area.
So if I'm asked, do you have insurance? And I say, I don't have any insurance, can I still be seen?
Oh, absolutely. You can still be seen. As a federally qualified health center, we see patients regardless of their ability to pay. So without insurance, that individual would be placed on what's called a sliding fee scale. And based on their income and how many individuals are in their household, we slide, in other words, reduce that payment to what can be afforded.
Do you receive federal funding?
Yes, we do. So we are considered a federally qualified health center. There are 54 federally qualified health centers in Florida, 1,400 in the country. So we do receive funding to help us treat the uninsured and the underinsured patient population.
What if I can't pay anything?
So what we have in each of our health centers that we're very proud of is our navigators, case managers. And so if you are a patient and you're not aware of coverage or any support or any assistance that you might have to pay for your visits, we set up appointments with our navigators, and those individuals meet with the navigators, and that navigator navigates their eligibility. So they work with them to see if they're eligible for Medicaid, Medicare. There's also the the Polk healthcare plan and the Polk non-healthcare plan, and that's supported by the half-cent sales tax in Polk County. And so our navigators are very well educated to be able to work with those individual patients and determine what they do qualify for. But if that particular individual does not qualify for any type of coverage that I just mentioned or services, then as Dr. Nelson-James mentioned, that's when we would put them on the sliding fee scale and we would work with them to see what they're eligible to pay for that day. And sometimes it's $5 and sometimes it may be $20, but we work with that patient because we do not turn anybody away for health care.
I think that's a very important factor. Can you repeat the call center number again?
Sure. The call center number is 866-234-8534.
And Carol, I will add also that if an individual does not have money to pay for their visit, that yet still is not a barrier. We work with those patients to put them on some type of a payment plan, and we will take whatever they have at that moment in time so that they can get care.
Central Florida healthcare is a very important asset to our community, and I don't think people realize that they can get care there, and there is access to care in our community. What type of preventive programs do you offer?
So Central Florida Healthcare has, and I'll let Dr. Nelson-James add on too, but many preventative programs because we want to work with those individuals that may have high blood pressure, that may have diabetes, and we want to promote the wellness visits, work with them to set up and establish their care with a provider. And so if we can identify that applicant, or I'm sorry, that patient is diabetic or has high blood pressure or has any underlying conditions, we want to work with them and make sure that they come back for follow-up visits and that we really focus on that individual patient and their specific needs.
Right. And I will add that, as part of the preventive care visit or a wellness visit, we're screening those patients for whatever type of social habits that they may have, tobacco screening, alcohol screening, substance abuse screening as well. And of course, through vitals and lab work, we're screening for high blood pressure, diabetes, high cholesterol. We interview patients and get their entire family history, their social determinants of health to see, what their housing situation is like as well. And we are offering vaccines as primary preventive care. We do colon cancer screening. We offer breast cancer screening. So whatever is age appropriate for that individual, we're screening for. Then if we find that they have any chronic medical problems, then we're using best practice and the standard of care to manage those chronic medical issues.
Great. Now, do those navigators help with transportation and food insecurities and housing if the patients have issues?
Yes, they do.
Relating to that as you go through the interview process.
They do, Carol. They are trained to work with those individual patients to determine what other needs they might have, whether it's housing, as you mentioned, food insecurities. We are a proud partner of Ending Hunger Initiative through the United Way. And so we have programs set up to feed families. Every day, our teams are out working with those individuals that might need food. And as a federally qualified health center, we are required to provide transportation for our patients. So if we have a patient that calls in and says, I can't get to my appointment, then we will set up transportation services and provide those for the patient. And if there's services that perhaps might be needed to Moffitt, if they've been diagnosed with cancer, then we also provide transportation for those extended services.
What about if you see a patient and it ends up that they need surgery? How is that handled?
So there are several programs that are available, particularly here in Polk County. One of the main resources that we utilize, depending on the surgical need, is We Care of Polk County. So we partner with them, and that's an organization that gets volunteer hours from partners, medical partners in the community. So physicians volunteer their services, as well as surgical centers and the local hospital. And so if somebody needs surgery, providing that We Care has that general surgery service, which often they do, then we are able to refer that individual to them if they're uninsured. Of course, if someone is insured, then we would refer them to a surgeon based on who is on their insurance plan. Fortunately, as well, if we find that there's a tissue diagnosis for some type of cancer, we are able to partner with Moffitt and refer patients there, providing that there is a definitive diagnosis. Often they will take them in their charity program.
What about something like heart surgery?
Heart surgery would be rather difficult if it's a completely uninsured patient. Cardiothoracic surgery, I don't believe, is a resource at We Care. However, we do know that Bay Care Health Systems has a charity program, and sometimes we're able to get an individual for surgery there.
Does Lakeland Regional also have one?
That's a great question, Carol. I'm not sure. I don't think that I've had much success sending patients to Lakeland Regional for heart surgery, but I do know that Bay Care and Advent Health have taken some of my patients personally.
Great. Thank you. How are you addressing medical literacy? How do patients know where to go for care, whether it's a doctor's office, urgent care, or freestanding emergency room? I think we're getting back to the call center, right?
Right, exactly. Our call center is open from 7:30 in the morning till 6 p.m. in the evening. So during regular business hours, an individual is able to call the call center. And if they're an existing patient and need a question specifically answered by their clinician that they usually see, they have the opportunity to either get transferred to that site or send a message through what we consider to be a patient case to that clinician. Remember, I also mentioned that there are nurses in the call center. And so for acuity purposes, then those nurses could also determine, do they need to be seen right away? If there's an emergency, if somebody calls, for example, and says they have chest pain and it's accompanied by shortness of breath, then that we consider that an emergency. And so they can provide instructions to go to the emergency room or call emergency services for that individual.
What languages do they speak at the call center?
So in the call center, there are those who speak Spanish. That is our number one second language other than English. And then also there are some Creole speaking individuals in the call center. But we are also required to have language line services available to our patients who speak other languages. So yes, they may be able to speak to someone in their native tongue that in person at the call center in Spanish or Creole, but we use a service also called Proprio, that if someone calls in any other language, that we have the ability to use translation services for them as well.
Is it hard to determine what language they're speaking in?
Yes, sometimes, especially if it's a dialect, oftentimes it's not a set language, and that can sometimes make it challenging. But usually we're able to get in touch with the language line and get them connected.
And they can probably determine.
Correct. I will also add, Carol, as you were asking about medical literacy, after each visit, the patients do get what's called a patient visit summary. That's part of us being a primary care medical home. It is required. And on that summary, we also have language that directs a patient that if they're having issues after hours, they can call our call center. And those calls are routed to an after-hours service. Each of our service lines, including adult medicine, pediatrics, OBGYN, dentistry, and behavioral health, has a clinician that's on call 24 hours a day on the weekends, on the holidays, that if a patient needs an answer to an acute medical problem, those calls get routed to a clinician for them to answer.
Right. What are you doing to educate the public about all of this?
So I'll take that one. So we have a lot of partners that we work with. We focus on building strong, solid partnerships. And so a lot of what we do, both with partnerships, if we serve on committees or boards with individuals, we also have our staff is out and about most days, either doing the Ending Hunger Initiative, or we have our mobile units out partnering in the schools, or we might be attending healthcare fairs. But we try our very best to continue to educate the public and make sure that they know what our services are about and what we can do to help in the community. So it is an ongoing effort, certainly, to continue to educate the public on the services that Central Florida Healthcare offers.
Can you talk about what you're doing with Crystal Lake?
Sure. So Crystal Lake is a community partnership school, and that was established about 5 years ago. And that was working with our local partners on establishing what school and what area might have a need for a community health center to be on the campus. And so after probably about 2 years of working on this initiative, we came to the conclusion that Crystal Lake Elementary would be a great location to help the community and to have a health center on campus. And so we have been there probably 4 or 5 years now. And it's just 2 portable units that have been put together, one to provide healthcare to the public, and then one where the students can be escorted with one of the staff at Crystal Lake Elementary to be seen by our provider. So it has been working very well with all the partnerships that we have. It's been very successful, and we're excited for that opportunity to be at Crystal Lake Elementary providing health care.
So if I'm a member of the public, can I just walk into that clinic, or do I still have to go to the call center?
You can walk in. So we do accept walk-ins at that location and all of our locations.
Right. And I'll add, Carol, that location at Crystal Lake is very unique in that health center on the campus of Crystal Lake Elementary has essentially 2 entrances, right? It has an entrance for the community, and it has an entrance for the kids from the school. And so it's locked in between, so the kids can't escape, and no predators can get on the school campus. It is pretty neat. But we have one provider that can toggle between both sides and see both those from the community as well as those from the school.
Do you know what your volumes have been offhand?
So we have one mid-level provider, an APRN, who sees probably 22 patients a day at that location.
Yes.
Very nice.
And as you talk about education as well, I would be remiss if I did not mention our development and outreach department. You'll see that there are several billboards around the community that is also trying to educate the community as to that we are here and available to see them. Our vehicles are all wrapped with our number and the services that we provide. And sometimes if you pick up the Central Florida Health News or Viva Poke, you'll see articles from Central Florida Healthcare in there talking about medical conditions and what to do if you have certain conditions.
Okay. Can you repeat the call center number one more time?
Sure, 866-234-8534.
Thank you. Many clinics push the use of the patient portal to communicate with patients rather than having direct communication. There are still many people who are not comfortable with using it or don't have access to a computer or cell phone or just are not able to do it due to age or disabilities. How are you addressing this?
So I'll take that. We do have a patient portal, and we realize that sometimes adoption of the patient portal use is limited. And so we have clinical support staff that reaches out to our patients by telephone manually, and that may include a nurse or a medical assistant, and that is our major way of communicating with our patients. We also do have a growing managed care team, so our patients who might be elderly and have Medicare, those individuals are also contacting those patients on an interval of maybe every month and hand-holding to ensure that they understand what needs to be done to improve their health care.
If a patient, an elderly patient, doesn't have a cell phone or a phone, what do you do?
That might sometimes be difficult. Sometimes we have to reach out to family members if they don't have any type of contact source, and sometimes even by snail mail. we will send something out. If we cannot contact a patient, there are times that we have even gone as far as to send the non-emergency police out for a wellness check.
Great. Well, tell us about your new health center project across from Lakeland Regional Health, and what change in services will you be offering?
So we are very excited for our new 4-story state-of-the-art health center, which will be 33,600 square feet. And it is being built in the current location. So if anybody drives by, they will see progress happening. It may look like not a lot of progress right now, but probably in about 2 months, when you drive by, you will see 4 stories because this is a modular building. So floors 2, 3, and 4 are being built off-site. And so as soon as floor 1 is ready, they will, just like almost like Legos, they will stack the floors and begin the internal and the external finish of the building. So we're very excited for that opportunity. And as we mentioned earlier, we have Lakeland Pediatrics that's down on South Florida Avenue that provides pediatric medical and dental services. That will move to that location, as well as adult dental, which is on Lakeland Hills, that will join that location. And of course, Crystal Lake Elementary will stay where it is. So those services will come into play. We will have behavioral health, a bigger presence for behavioral health, the opportunity to see more adult and pediatric patients because we'll have a larger footprint at that location. And then we have the OB/GYN services. But one thing, too, that we're very proud of is that we will have a diabetes center of excellence. So that location will have a teaching kitchen and will be staffed with a nutritionist and individuals that can work with those diabetic patients and also perhaps the obesity patients. But we'll be able to do cooking classes and education and different things for our patients that might need those services. So we're very excited about that opportunity.
What an expansion. What are your hours again? And how many days a week are you open?
So our Lakeland site is open 6 days a week. So that is one of the locations that is open on Saturday. And so we are there from 7:30 to 6 days a week.
And again, the new health center will open, the new building?
We are scheduled to open in March of 2026.
A lot of exciting news coming along. So are there other things that we haven't talked about that we've missed?
Well, I think we covered a lot, but I think I would just like to add, and this is something that Dr. Nelson-James talks a lot about. So being a patient-centered medical home, we call it an FQHC, Federally Qualified Health Center, and Joint Commission accredited, there are a lot of standards that we are required to do and to report on. And so the fact that we are Joint Commission accredited, I think says a lot for the services and the quality of services that we provide. So I'm very proud, and I know Dr. Nelson-James is too, that we can really talk about quality health care and about our outcomes and the results that we get. And she probably will like to add maybe a few words to that too.
Well, sure. I'll toot her horn a little bit about the Joint Commission accreditation because you don't find many ambulatory centers that seek out Joint Commission accreditation, right? And so we all know that's an accrediting body that really comes and inspects on approximately 1,500 elements of performance. And they do show up at our doorstep to do walkthroughs and manually inspect. Our last one was unannounced. Yeah, well, this past survey was quite shocking because they were scheduled to arrive in March or April of 2025, and they showed up the week before Christmas last year. So to say the least, we were very shocked. And so, but we, passed with flying colors. And so we always stay prepared, as Ann mentioned, and continue to provide quality service because they can show up at any time.
And is it on a 3-year cycle?
It is on a 3-year cycle. You are certainly right. And so we go through that rigorous inspection every 3 years. And also we do get inspected by HRSA, the Health Resources and Services Administration, every 3 years as well, because we're an FQHC.
Final word, Ann?
I would just like to say thank you so much for taking time to talk to Dr. Nelson-James and I and to hear more about Central Florida Healthcare and all the services that we provide. And we welcome anyone to.
And one more time, the call center number.
The call center number, 866-234-8534.
Thank you very much.
Thank you.
Thank you for having us.
Thank you for tuning in to Listen Lakeland. Your feedback is valued, and we encourage you to head over to www.lakelandvision.org to participate in our monthly survey related to today's show topic.
I said, welcome to the good life.
Listen Lakeland is brought to you as a collaborative project between Lakeland Vision, the City of Lakeland, and Hall Communications, a community working together to provide an exceptional quality of life. Want to watch the show? Check out the video version at lakelandvision.org. Thank you for being with us.